Okay, so sir, I have already washed my hands. Okay, good afternoon. My name is Meryl Joyce Colong. I am a secondary medical student from Davao Medical School Foundation. Okay, so before anything else, may I know your complete name?
Cleveland the second Rosero Perez.
What's your age?
9.
Your address?
Annual Homes, Kabantian, Davao City.
Okay, so how about, are you single or married?
Single.
Are you already working or still a student?
Student.
Your religion?
Christian.
Okay, so for today, I will be conducting what we call the cardiovascular assessment. Okay, so in general, cardiovascular assessment is to check whether there's any abnormalities or signs that I can see later on, which would reflect your cardiovascular condition. Okay, so this assessment comprises different tests. First would be the assessment of the carotid pulse, followed by the inspection of the chest and palpation of the chest as well, and then the percussion, and lastly the auscultation. Okay, so do you have any questions before we start? May we proceed? Okay, so first I want you to lie on your back. Okay, very good. Okay, so first I will be doing the assessment of the carotid pulse. Okay, so carotid pulse is located anterior medial to the sternocleidomastoid and at the level of the cricoid cartilage. Okay, so I'm going to use my index finger as well as my middle finger to check for your carotid pulse. So I want you to, I don't know, later na lang, sir. Ayan. I'm going to check for the carotid pulse first. Okay, so now I can already identify the carotid pulse. Okay, the carotid pulse that I can feel here is smooth, relatively rapid upstroke, and smooth, more gradual downstroke. So which means the carotid pulse that I can feel right now is normal. Okay, so next, I'm going to check for the symmetry. Okay, they are symmetrical and in normal rhythm. Okay, so next, I am going to inspect your chest. Okay, so I want you to pull up your shirt and then place your hands at the sides. Okay, so for the inspection of the chest, okay, the patient is comfortable and breathing normally, so the patient is not tachypnic, and there is no sign of pallor as well as cyanosis, and there is no surgical scars noted. Okay, so next I will be palpating your chest. Okay, so first I am going to identify the point of maximal impulse of the apex. Okay, so I am going to use a tangential light, which means I will shine light across your chest wall to check for the PMI, or the point of maximal impulse of your apex. Okay, so I can now locate the PMI of the apex right here. Okay, so to accurately locate the apex is located at the 5th intercostal space, okay, of the left mid-clavicular line. Okay, so first I'm going to identify the 2nd intercostal space, then the 3rd, the 4th, and the 5th intercostal space mid-clavicular line. So I can feel here the PMI of the apex. Okay, the characteristics of the PMI, or the impulse of the apex, it is single outward impulse, which means the PMI of the apex is normal. Okay, so next, I am going to check whether there is presence of parasternal heaves and valvular thrills. Okay, so the difference of these two, the heaves, we are going to identify for the presence of impulse on the left side of the sternum, and for the heaves, we are going to identify vibrations, which implies loud murmur. Okay, so for the keys, I am going to use the base of my hand. And I'm going to place it at the left of the sternum to check for vibration. Okay, so there's no what I mean is for impulse rather. Okay, so there is no impulse noted because normally there should be no impulse or there should be a slight impulse noted. Okay, so next is the frills. For the frills, we are going to check first. Okay, the second intercostal space at the right side. Okay, so I'm going to use the balls of my hand to check for any vibration. Okay, there's no vibration noted. On the left side, second intercostal, no vibration as well. On the third, no vibration as well. So there is no heaves and thrills noted. Okay, we will now proceed to the percussion of the chest. So we will start with the left portion of the chest, starting with the left intercostal space. Okay, so we will start on the lateral side. Okay. Okay, there's a dullness here. Third intercostal space on the lateral side. Okay. And the fourth intercostal space, the lateral side first. Okay, there's dullness here. The fifth intercostal space, lateral side first. Okay, so there's dullness here. So the dullness implies the borders of your heart. Now we will inspect or percuss rather on the right side of the chest. Okay, so starting with the second intercostal space is to check whether there is presence of enlargement of the heart. Are you okay, sir? Okay. The third intercostal space. Okay. Fourth intercostal space. Fifth intercostal space. Okay, so far on the right side, there is resonance. Okay, so which means there's no sign of enlargement of the heart. Okay, so now lastly we proceed to the auscultation of the heart. Okay, so for the auscultation, I am going to use the diaphragm of the stethoscope. Okay, so I will start first with the right second intercostal space of the right side. Okay, so this is the aortic area. Okay, and then the second intercostal space on the left side, or the pulmonic area. And then, next is the third intercostal space on the left side, or the Erb's point. And then, next is the fourth intercostal space, or the tricuspid area. Then lastly is the fifth intercostal space, the clavicular line, the mitral area. So the mitral area usually is where you can hear the murmurs. Okay, to double check, we will also auscultate the axillary portion. Okay, so there is no presence of murmur. Okay, so next I am going to use the bell of the stethoscope, okay, to check for any low pitch murmurs on the mitral area. Okay, so far, there is no murmurs noted. Okay, sir, I want you to sit up straight. And then take off your shirt. And then lean forward a bit. You lean forward and then like that. Okay. So I'm going to check for any early diastolic murmur on the fourth intercostal space, or in the lower sternal border of the heart. Okay, so sir, I want you to inhale, and then exhale, and then hold your breath. Okay. So far there is no any murmurs noted upon auscultation. Okay, so to summarize this assessment, from the assessment of the carotid pulse to the inspection as well as the palpation of the chest to the percussion and lastly to the auscultation. Okay, so the findings are normal, so there is nothing to worry about. Okay, so to educate you a little bit, no, we all know that exercise is an important activity which helps make our hearts healthy. Okay, since you're a student, most of the time you spend your time in your room studying. Am I right? Where do you usually what do you usually do during classes?
Outside.
Okay, you play outside. You do that after class. Okay, so since today we are having online class. Okay, so most of the time nakatutok tayo sa computer, nakaupo most of the time, right? Okay, so it is I advise na but what you're doing is right. Okay, so after you have a class, you may play for a little while so that our hearts will be healthy. Okay, so you have to exercise. Aside from exercise, you can bike. Okay, what else do you do? Bike or do jump ropes. Okay, so which is a good thing for your heart. Okay, so do you have any questions, clarifications? Okay, thank you so much and have a great day.